take them off.
I mean, you can X-ray through anything. It's a matter of whether it's going to show up in the X-ray and block what you're looking at.
I think they're going to be very
And the other-
squeamish about trying to interpret a C-spine film with
And
stuff behind it.
the other thing too is that we like to see. We need to visualize the patient and
Yep.
see what we're dealing with too,
Especially
and
if
that.
there's lung issues in that, we need to get them.
You know,
That
all
guideline
those
actually-
metal.
Oh yeah,
That would all show up
Oh
on
yeah,
their
it
body.
does. That's-
That guideline actually recommends, if possible, X-raying through it, but in reality, I'm sure that when you're there, the ER doc's probably gonna ask for assistance in getting this off. What this document recommends, and this is where you guys are expert, but we'll see what you think, is having somebody approaching this direction, with their forearms on the person's chest, holding the mandible and occiput to provide stabilization, then forming a group to do a lift, while that person's levitating and you've got that inline cephalad-directed immobilization, then the person from behind, after the helmet's been loosened up, can remove it straight and the pads in one move, or two moves, but in one fell swoop while that person's out. I don't know if that's how it's being done, and what your experience is.
It's a multiple person deal. But underneath the chin, like you said, that's the standard for holding stabilization.
But I don't think we lift them up. I think more likely that we would take the helmet off while somebody's holding, and then we would roll them to get the pads out.
Yeah, we rolled, that was the last time we did, we ended up rolling the kid to get him out of his pads, but it's just like, that's a lot of movement.
So as soon as you cut them, they should be able to just reflect back.
Yep, they reflect back. That was a weird. Are you talking about 2 weeks ago?
No, this was, I think 2 weeks prior to that. I don't remember who it was the other
spine
team.
boarded.
It was like,
Yeah,
Spine boarded
North
2
Eau
kids.
Claire.
Oh, that North. I spine boarded 2 North kids.
yeah.
That was a rough freshman.
What's the recommendation though? I mean, you're going to have to get the torso and body up in order to get those pads off. You're holding the head there, so now you got to have a guy on each side to lift the body up with the head.
Well, yeah, at least how many people.
And then
it
one
takes.
person at the head
That's why I'm
pulling the
wondering
pads.
if that removal process should be rehearsed in the ER setting. It's probably gonna be done, is it done in the ER or is it done in the radiology
It's in the
suite
ER.
mostly?
And
Yeah.
In the ear
You know.
room, we feel everything off.
Because last one we had, the kid was moving and functioning but had a lot of pain. But the person who comes in already with motor sensory change, boy, that'd be scary to remove that without really controlling them.
Part of the issue you're going to run into though is every doctor's going to have their own preference as to how they do it. And
I know. It'd be nice if we could standardize it across people who work there.
amongst multiple
And
things.
I'm gonna, we're talking about tomorrow.
Yeah.
And so, and Dr. Wolf, is a sports medicine guy training. So I'm hoping that, maybe he has some suggestions for sort of standardizing and practicing it as a group and figuring out just how many personnel it needs and to do it right.
kind of the other problem I see with lifting the patient when they're already in the emergency room and on the stretcher is that your body mechanics aren't very good for that,
I know,
because the bed is too high for you to be able to really lift and feel like you're doing a steady job of lifting the person up to get the stuff out from underneath them. Where if you have them on the ground, you have people, it's a little easier for you to lift the patient up and get that stuff out.